Start recording, we just start this.
Yes, correct. And then also, now that we're uploading it onto YouTube, because on Facebook it only stays for 30 days, but when I upload it onto YouTube, it just stays. Yeah, so after we record this, then I'll upload it to YouTube.
Oh, it cannot go directly to YouTube?
I thought that we could do it, but you have to have X amount of users, or X amount of followers.
How many?
On YouTube's. I think it's like 1,000 followers or something.
Yeah. For it to be live.
Yeah, in order to go
YouTube.
live on YouTube, you have to have like X amount of followers.
Okay.
So
I actually signed. I said I subscribed. I
yeah.
just
Okay.
followed
Thank
it.
you.
Yes. So
Thank
how
you.
many followers?
So we can just like get everybody to follow. Then
And
that'll be
YouTube or
easier
Facebook?
than my two-step process right now.
Because right now we're two-step.
Yeah.
We go live in
Facebook,
and then
I
to
transfer it.
YouTube.
Yeah, because Facebook only allows us to keep it for 30 days.
Yeah. And so how many users for YouTube do we need to have?
I think it's 1,000. Let me double check that. But
Let me check.
I
Because
think it was 500.
I don't think the Mayor's Council has 1,000 followers.
Oh, and you guys are live on
The
YouTube.
Mayor's Council has
Okay.
theirs on YouTube.
even our church.
Okay, then it's
Yeah.
Instagram that's 1,000 then. So YouTube
Maybe
is
Instagram,
less. Yeah.
but not YouTube because I know that the Mayor's Council doesn't have 1,000 followers.
Okay, let me double check. I could be mixing it
Because
because
there's
I know
YouTube,
one of
right?
it has a minimum requirement of followers.
Yeah. Now I'm gonna go to the day of reflection. Oh, because I had a retreat at Momo. Oh, it's Lenten retreat for Brazilian. Oh, okay. At the no, just at the St. Joseph. Yeah.
Oh, it's just 50. 50 subscribers on
Yes,
YouTube.
But I don't have 50.
We don't have 50. Everybody who works here at the health center, we would need the 50.
Chamber, I'm going to register as nonprofit. But because if you register as a clinic, the clinic is not nonprofit.
But we're government. So I called and
What did they say?
they said same.
110.
110
Are you going to pay for
or
it?
non-profit.
You want us to pay for it? For YouTube or Facebook? And I'll just take it to the.
Yes, okay, because I told Deborah to, but
It takes long. Yeah. Okay, so we'll just get 110. No, just give it back to you. And it's to the Chamber of Commerce, right? Guam Chamber of Commerce.
maybe I'll forward you the
We're live right now on Facebook.
I'm gonna
Oh,
write
okay,
it.
yeah, just
I put the link in our CHC chat.
110. 110, right?
yes, 110.
Oh, if you use a desktop to go live from YouTube, you don't need a minimum. But if you use a mobile device like an iPad or your phone, then you need 50.
Okay.
Yeah. So if we at least
So
have
please,
everybody
if
from
you
our...
have- If you have YouTube and, because Sherman didn't put it in our chat, and so, because as soon as you did it, I did click to follow, so.
Yes.
Yeah.
So if all of our
To subscribe.
staff, at least, all the staff of the CHC, then we would already have...
Even with the board.
Yes.
Yeah. Today's the 19th, right?
So you need us Instagram and YouTube?
No, just YouTube, right?
Just the YouTube I
And
created,
Facebook,
yeah,
if you-
and Facebook, so that in the future we'll just go using YouTube because that stays on the site where there's no minimum amount of days, and then we can always just put the link of YouTube Live onto Facebook for those who,
Okay.
yeah. Just call me if anything.
Hi, Dory. Hi. Good morning. Yeah. Okay. Okay.
Sorry, we have an extra pen. We keep getting this back. No.
I can run and get one.
Okay. Uh-huh. So next. Mm-hmm. Yeah. Okay. Okay, I will. I'll give it to you later, okay? I'm in a meeting right now. I'll stop by the center. Okay? Okay. Can you have them make a copy of it? No, I'm talking to. I'm in a meeting right now. Okay? I'll stop by the center when I'm done. Okay? Okay, that's fine.
Do you have any other post?
No, because we have a purchase order. That's the only problem is that the purchase order. So she'll send the email, send Annie the email so that it shows why we're from Chamber. Good morning. How are you?
Share with Mom. Sure.
Good morning, everyone. This is the Guam Community Health Center's Board of Directors regular meeting. Today is March 19, 2026, and it is now 10:06 a.m. We are here at the Northern Region Community Health Center conference room or multi-purpose room.
The
Community Resource Room here in 520 West Santa Monica Avenue in Benito. This meeting is now called to order. As in compliance with the Open Government Law, this meeting was posted on the Guam Daily Post on March 12th and March 17th, as well as the Government of Guam meeting portal. To meet all the requirements of the Open Government Law. Okay, as I said, this meeting is now called to order. It is 10:06. The sign-in sheet is going around. We do have 7 members present, so please sign in. I want to acknowledge our Executive Director, Ms. Sherman Lynn Pineda, as well as our Medical Director present is Dr. Bob Leon Guerrero. Okay, and our finance staff is Debbie Paulino, okay? We'll go ahead, we have public comment. There is no public here for comment, so we'll go ahead and review and approve the minutes. It was emailed, right? Sure. Yeah, it was emailed to us.
That is also in the packet.
It is also in the, it's also in the packet. I move to approve the minutes. Okay, there's a motion by Sonia to approve the minutes. Second by Mayor Allen. Ron. Okay. Any discussions? No discussions. All in favor say aye.
Aye.
Opposed? No opposed. Motion passes. The minutes are approved. Old business?
So, good morning.
Good morning.
I just want to update everyone on Next Gen. So, our go live schedule last month was September, but now it's moved to mid or late August. We're hoping it's gonna move up some more. There's actually a new program manager assigned, and we're moving faster. You can see we're having meetings, different sections simultaneous in a week. We'll have 1 to 2 meetings with different groups, sometimes with the whole team. So it's looking very, very promising.
Who are the meetings with? Next Gen and
Yes.
and OTEC?
Next Gen, OTEC, our team, because now the clinical team is involved, because we're building their system now. And then this morning we had a meeting to talk about the entire plan. So it's looking good.
Okay.
Yeah. We're moving faster than
And so
how
the
we-
input from the different sections are being
Yes.
done and included into the
Yes.
EHR.
Yes, so we're already building the scheduling administration, so this would involve medical records, registration, and nursing. So this is where we're at right now, and we're also having meetings. We've already scheduled meetings for behavioral health and for the other sections. For Medicare, we got rejected again. So the process is we submit and then they tell us, no, this is wrong, you don't have to apply. So we submit again for a renewal, and they said it's not a renewal. So the process is not, we submit and they tell us this is wrong and this is the right process. So it's like a hit. So we're trying everything, yes. So we did consult with a CMS person, but it's very vague, so maybe we'll go to another CMS consultant. The director has mentioned that she has several CMS consultants that she knows of. So maybe we'll go that route. And I'm thinking maybe this is why we were not able to renew the Medicare for the
From the
longest.
beginning?
Yes, from the beginning. It's very
And maybe they gave
challenging.
up, right?
Yes, or maybe nobody
Yeah.
followed up.
Yeah.
Sherman, can we look at the process of how we did prior? I mean, we were once getting Medicare, so
So
could we find out?
yeah, Miss Annie, what happened was 5 years ago there was a shift. So
Yeah,
now
there was a
CMS,
change in the-
yes, CMS became involved. So that's why I don't know if it was a reapplication, renewal. So we're trying to do those, but they're saying that's not what you're supposed to do. But at the same time, they're not telling us.
There's no guidance? They haven't
Yes,
provided
there's no
guidance?
guidance that this is where you're supposed to go.
I thought area was supposed to be helping us.
Yes,
with
and
this.
there was a CMS
Yeah.
consultant.
At the PIPCA.
Yes, yes.
Bless you.
But it's not. I don't know.
Yes.
That what's our challenge with the consultant? It's very vague. It's not. How's it right?
Yeah,
The
they'll
guidance.
just say return if you're trying to change,
Yeah.
select change, but we're trying to do two different things, but we can only select one.
So yeah, it's not straightforward. So we're gonna go through the consultant of the director and we'll try that route. So we did try applying online. We tried applying.
Did you actually mail?
mailing? Yes.
Yes.
So
Sherman, can we try? I mean, isn't GRMC and GMH our counterpart? I mean, can we consult with them too and find out how they're getting their Medicare?
okay. Yeah.
Yeah. And you know, that's a loss for our program income.
Big time.
It's a little over $60,000 that we're losing out per year. And, you know, that's affecting our program income right now. And this is already how many years? 2, 3, 5 years? Yeah. Okay. Alright, and then anything else? We already talked about the
The
YouTube.
YouTube.
Yes.
And then for the last month, the board approved for the adjustment of the Saturday clinic hours. So right now we submitted our request for the change in hours to her. So once I made some adjustments, to the strategic plan especially. It was emailed to you last night, if you can review, so you can approve by next month. But the co-applicant agreement was emailed already since December, I emailed again last night. Are we comfortable to approve, or did you still need
With
time
the
to
co-applicant?
review? Yes.
Well, can we just still review that and then just let you know if you're ready to,
Okay.
yeah. Because I know that with the new public law that was, passed,
Oh, okay.
we have to come up with an agreement between us and the Department of Public Health, right? So,
But what about the bylaws? Are we?
yeah, the bylaws, and
with
then the bylaws, can we use your room or your room? Do you have just your,
I just open.
oh, yeah, just to have a subcommittee meeting. Yours or hers?
You can use mine.
Yeah, cause it's more central.
The locals are there, it's fine.
No,
No.
yeah.
No, but it's just open. So.
Oh,
Yeah.
it's just okay.
We'll just put a table together and talk like
Okay.
this.
So we do it there?
Yeah. We'll see, we'll schedule, can
Let
we,
me know.
yeah.
How many can you review at a time? Cause we also have the sliding fee discount, policy.
Yeah.
That we need to approve. So maybe 4 bylaws, co-applicant agreement, strategic plan, and the sliding fee.
Yeah, okay. We'll schedule for either next week, subcommittee, those that can help with the bylaws and the strategic plan, the co-applicant and the sliding fee. Okay? Next week is, no, not
You
yet.
have the following.
The following week is not yet.
Wednesday and Thursday's not good. We have enough tomorrow.
Can we do it Tuesday morning? Or
Good morning.
can we do Tuesday?
Tuesday?
Yes.
Yeah. Yeah.
Are you, Tuesday morning, or when is your Monday?
Tuesday on the time.
Oh,
We're gonna do it morning or afternoon?
what time is your time?
Cause it's like, I'm sick, I think you have to,
Can we do it, want to do afternoon?
What time?
Your schedule.
How many hours you take?
Maybe 3?
Like 3 o'clock to?
Oh, no, cause you work in the afternoon, right?
Yes.
2 to 5.
2 to 5,
2 to 5? Okay.
okay?
2 to 5 next week, Tuesday?
Okay, so the subcommittee will meet to go over these 4 things, okay? On Tuesday, the 24th. Okay? And then, so that would be then when we're done, we'll go ahead and send you an email, Shirley.
For the CEO's report, the operational update, we looked at the last 6 months from September 2025 to February 2026. And over the 6-month period, the Northern Clinic carried the majority of patient demand. So we can see here that in the we saw a total of around 11,000 patients in the last 6 months, and 73% were seen in the north. Estimated walk-ins represent 15% of the visits, so it's very, very high. The average no-show rate in the north is 29% and 15.8% in the south. But in the last couple of months, February and March, we see a trend of the no-show rate going down. So last month, it was at 27%. In January, it was 27%. In February, it was 26.8%. So it's going down very gradually. But if you look at the prescription volume in the north in the last 6 months, we prescribed 3,028 and only 16 in the south. So
Are patients using the QR code?
yes, they are.
Okay. presence of our CPHO. Thank you, Chief, for joining us today. All right, so that's great. That's great news that the QR code is working, right?
But at the same time, there are still patients who prefer to be able to speak to somebody and listen to somebody's voice. So that's still something that we still have to work on.
They will if they use the QR code. Somebody will call them. It's not a machine,
Yes, that's right.
right?
Yeah. So for page 2, there's the graph shows that the patient volume trend is going up. So during the holidays it went down, but we are recovering. No-show rate trend again during the holidays it was higher, and hopefully no-show trend will be more stable. Walk-in trend very high in the north at 15%.
No, because there's sometimes when some walk-ins are more urgent than others, so the ones that they can't accommodate because of the number of providers that we have, they're actually advised to go to another facility.
Or we can schedule
Or,
them.
yeah.
So we're actually only tracking the walk-ins that we see.
Yeah.
We don't even know the number, how many
While
were.
who walked in,
Yeah.
who were referred. I think we also need to track that, who were referred to another clinic or.
They still get screened by the nurses' aides, but that's where the nurses' aides will say, you know, you're like number 13
For the
on the
triage.
walk-ins. But there's like 8 in front of you that are more really priority. They need to see the provider. So,
And if we can also include that in the data, to track that we have advised or advised them that your this, are you willing to wait, or is it okay
or
if
they
we can
reschedule an
them?
appointment for
Yes,
them later.
yes.
Yeah.
Yeah, so more or less we can anticipate, you know, do we need to have more providers, schedule and identify particular day, maybe like, how many walk-ins usually is there a pattern trend, like Wednesday or Thursday? Let's just. Oh, okay. Thank you.
No. But it's slower than anything. Yeah.
Yeah. Just make sure name if
Okay.
you're not done yet.
Yes. Now I'm done. Thank you.
Sorry, for the past couple of days there was no construction.
Y'all put it to work today.
And then they started again. Yesterday there's not.
Oh,
We
yeah?
had the animation. Yeah, yesterday there was no.
Dr. Bob, on the no-show
Come
thing.
over here. Come on. Mala, get
Yeah,
Loki.
I'm
Move
anti-social.
Malo.
I know, but we cannot
Get
hear
Loki.
when they start drilling.
Yeah. We're also gonna chew you.
What I like to do is, when are we having problems with our no-shows being turned, not no-shows, our walk-ins are being
Walk-ins
turned?
that-
Because I want to know what our staffing pattern is at that time, so maybe I can switch the staffing patterns, but if I don't know, I have to change. But that might be a moot point once, because I'll wait to get.
Well, Doc, I know that in particular, several times when I've actually brought patients over, it was actually adult patients. So they wanted to see either a nurse practitioner or a family practice, and all of them were booked.
Yeah, so what I would like to know, what particular day of the week, so
It
then
was
I
a
can.
Monday. I don't
Okay,
mind
so
Monday.
then maybe what I could
Mondays,
do
yeah.
is make it top heavy on Monday here.
At the beginning of the week.
Yeah,
Yeah, that was my intention, Dr. Bob, is for us to capture as well those walk-ins that we were not able to see, and if they decided to just go to another clinic or referred, and at least we will be able, again, your intention, identify the day of the week that we have that much walk-ins and what are the specific adult and tragic, so you can schedule your providers
I
accordingly.
know like Fridays we hardly,
Yeah.
and
right?
Fridays is
it's
slow.
slow.
Yeah.
So then
So maybe like Monday because it's over the weekend.
Actually, get that information from the triage staff because they know who and what days better than anybody else, right?
Yeah.
Yeah. Okay. Go ahead, Joe.
So for the program update, we actually onboarded this week our postdoctorate psychologist, so Chris Otero. So he is in the health center 4 days a week, and so he'll also be rotating in the south. He already identified some gaps in service that we can provide. Gaps in service that the other providers or clinics are not providing. And then we're also reaching out to specific populations, specifically the farmers and the VA, because I was able to attend some meetings where the director of VA was available and some providers working with farmers. I was also able to connect to them, so we're going to be meeting with them very soon, hopefully before the next board meeting.
Do you want to get on the agenda for the farmers co-op?
Oh, yes.
I'll find out from them. I'll stop by over there on the way to find out when their meetings are and if we can get on their agenda.
Okay. We are on the agenda for the Mayor's Council in April.
April 1st.
Oh, April.
You and I
Okay. Okay.
because I did put.
Okay.
I filled out the form.
All right. Because I asked
Joy?
Joy, and she said yes.
We are.
Yes, we are.
you want me to be there too?
That'd be good, Doc.
You could. It's
Yeah.
April 1st
No,
at
I just
10
want to
o'clock.
know. 'Cause,
Yeah.
Yeah, because you're the medical director.
yeah.
So do you want to include our outreach coordinator
Yes,
as
because
well?
they're
Reina?
also
Yes,
asking
asking
about
the schedule, but after the people, no one has
Signed up. Yeah.
Yes.
And it's really based upon the invitation of the mayor, right?
Yes.
So,
yes.
Because I did send, I filled out the request and I put your name as well, so we'll go in. And we only have 15 minutes. Whoa. Yeah.
only?
Yeah, only, right?
I'll talk fast.
Yeah,
15 minutes each.
yeah.
Oh, Mayor Alan is already blocking our time for the Mayor's Council.
Yeah,
You're gonna support us, huh?
Yeah.
And then we're revisiting our MOU with UOG. Now they are starting with internship requirement for all courses across the board. Not just for the sciences. So if you're in engineering, you do need to do internship because we're only catching the public health
sciences,
and
public
health
health.
sciences.
Yeah, right.
But now they're gonna open it across the board.
Good,
So
good.
everyone will have to do internship. So we're hoping, we're gonna get
I
more
persuade him to our field.
Yes.
Yes.
And the good thing with UOG is a lot of their professors are doing like capstone projects.
Correct.
So that's requiring them to do more outreach and stuff as well. Okay.
And I'd just like to update that we have adjusted our access to women's health services. So in the past, when patients walk in for women's health services, our nurses would see them. But that's not billable.
It's not billable.
It's not billable. And second, we don't count it as a first encounter for HRSA purposes. However, in that first encounter with the nurse, they would be able to, if there would be standing orders, they would receive laboratory requests. They would do fetal heart tone checks already, and then they would do the pregnancy test request already. So I think a couple of years ago we adjusted, and that's why there's a lot of complaints from the patients saying they've been turned away because we asked to reschedule them another time. So we're going back to the nurses seeing the patients again. So we're not able to build that first encounter, but they're gonna come back, right?
There's Okay, when before you came on board, when I did orientation with the billing staff then, because that's how they've been doing. That even before they enter and get evaluated by a provider, that they're billing already the 992 incident. I told them it's not allowed because that's a new patient. That can only be allowed for established patient. Now, in order to bill the full assessment of the nurses is we do an initial brief, overall checkup, and have a treatment plan of how to provide them. So after that, if they're in a rush, just wanted to see like if they're pregnant or not, if we can have them briefly do a brief assessment by our healthcare provider. Okay, confirm pregnant, this is the plan, you have to reschedule, and then so if they said, oh, can I do that, come back and we have a full assessment, then when they come back and our nurses take care of them and all this rundown of that can be billable because it's part of the treatment plan.
But the initial cannot.
The initial that has the initial that is not an established patient, new patient that has not been seen by a healthcare provider without the treatment plan and just went directly to the nurse for the full assessment, then that's not billable.
So we need a chart then.
Yes.
They visit then.
They visit,
make a chart,
they
yeah.
have the treatment plan. So especially for those walk-ins, rush, that I just want to be seen and confirm if I'm pregnant. I'll do the full assessment. I'm willing to come back. Then we can build that follow-up and have them on the schedule. But having a initial assessment with the treatment plan, that we need to have in place.
Okay, Dr. Bosch.
Look, a couple things in regards to the women's health. Dr. Billings wants to do more hours. Wait. But he was told down south they don't have enough business for him. So that's one problem. And I'm going, what we could do is that in this initial appointment, if they can, is there a way that we can bill them by having the nurse assess it and then say, let me talk to the doctor or the nurse provider, and he'll look at the chart, sign off of it, and then.
No, that's not allowed.
Okay, well, just asking. No harm in asking. But he wants to do more hours, but he was told down south that they don't need him.
But we need him in the north.
They probably need him in the south too, but it's just because they're.
Yeah, the way they said it.
Yeah. It's upsetting because he's willing to do more, and that's the other problem.
He does.
Yeah, he prefers to go south because the rooms are bigger.
Yeah.
And he likes the south. But the issue I have is that we don't. People still don't know us. They don't know us. Period. I mean, we're gonna have an OBGYN. I mean, we have an OBGYN who's willing to do OB and GYN. The outside one, Mr. Dr. You know who. I don't know which one he wants to do, but he's. So anyway, so we have an OBGYN. We're gonna have somebody on board that's family practice, but specializes in OB and GYN. And yet, people don't know, even the government of Guam doesn't know that we have this services. When I talked to Flores before she left, she says, oh, I didn't know you guys had that kind of crap. And she's,
she's part of our.
She's women's health.
Yeah.
We need to strategize how to bring forth what we have in the clinic, so people. Just as a side note, I saw a couple new patients yesterday, and I said, well, your kid's on the heavy side, so let's get some blood work. We can do it, and it's in the morning, and the lab's open in the south in the morning. Says, you guys have a lab? Where? They still don't know. People still don't know what we have.
And this is at the south?
Mm-hmm. They're from Malaysia.
Don't we have signs that say laboratory, pharmacy?
Do people read?
Mayor
Tony
went
yeah.
to the radio.
He was even
all their
Okay.
even did an outreach.
If you have somebody that works 2 jobs, he's not going to have time to read. He's not going to have time to listen to the radio. like I said, this guy takes his kids up to someplace central because they work at Pono's Hawaiian Grill or something like that. So and then he drives back, and I'm going. He's driving back and forth. I said, save gas, just come down here. But they don't. They still, for some reason, they still don't realize what we have at CHCs. And that's why a lot of people don't come to it. They still think we're a storage facility down there.
You know, one thing they do read is the chat, the neighborhood chat. So can we maybe have one flyer, says everything that we have, and have Mayor Tony, Mayor Franklin, Mayor Bada, put it on their chat, because people read the chat. I'm on the Enrohan chat because of my carnival rides, and there's hundreds and hundreds of people in that chat. Okay?
I actually have 2 brochures that have just been recently approved, so I'm gonna.
People read the chat because of the crime, be suspicious, be careful, so they read the chat.
Yeah, but that's neighborhood watch.
Yeah, but
You
Well, see,
can't put these things on the neighborhood. No, neighborhood is for the crime. That's why it was created. Unless they have another community chat where they can.
I don't know.
Yeah.
I know.
So like Dedido has another
Dedido has
community
a
chat.
community.
You have a community chat? You have a community
Yeah.
chat? Yeah. That's not neighborhood watch.
That's
Oh,
No,
Yeah.
yeah, we could put it, yeah.
Because you know, there's
Or
the police.
Facebook.
The police are very specific
Or
about
not
Facebook,
all
uh,
have Facebook.
Oh,
Yeah.
okay.
Yeah,
Like
so-
what
but we can.
Dr. Bob was just cited. He's a very busy. The client is a
busy
very
man. He
busy
doesn't
man.
read the
Back and
news.
forth.
He doesn't
Send it me and
read it.
send it my way. I'll just.
Yeah, maybe
Send
the
it.
other mayors are willing to start. I know,
Well,
has a
when we
buy-in
go to
staff.
the mayor's council,
Okay, yes,
that's something that we can
Okay,
put
yes,
on their
yes.
board. Okay? Yeah, that's a great idea, because our Dedido chat has
We're very
we know where all the Easter egg activities are gonna be from one point of the other
Yes.
island to the other, because it's on the neighborhood watch, so people are
And
gonna.
that's free eggs.
Yeah, it's free eggs. Anything for
You
free
laugh, but
eggs.
it's not.
Eggs are very expensive,
Yeah.
right?
Not as expensive like
They might be
gas.
wonderful eggs, but you know, there'll be eggs, right? So yeah, with the flyers, that would definitely help. We go to the mayor's council meeting, we disseminate that, we give it to them electronically as well, so
Correct.
they can, it's easier for them to
Yeah.
take it from one.
Prepare
But is
digital,
there a way that we can
because
talk to
they'll ask you guys to
other
just send it,
government
or send it to their.
especially the ones that deal
then
with
they'll
women's
disseminate.
health?
Yes, so she's working on the MOU with, UOG, and then, so, UOG, they do the breast and cervical also, right? They have their Cedars has a program,
For cervical.
no? But
We have our own program
So,
with public
yeah,
health.
yeah.
Yeah, I know, but what I'm saying is,
Is
the
other
outside government agencies,
Maybe what we do now that we have these brochures,
Bureau of Human,
Women's Affairs.
Women's Affairs, that one guy was at the head didn't even know we had this stuff.
Yeah. So she stays in her box.
Yeah, I don't know.
You know, Select Care usually has their brochure, because we're not in their brochure. Maybe we need to be in their brochure
Yeah.
for the government of Guam, because that's where the government of Guam can panel what doctors they want, what
We
what services. So
have a separate one, I think, for government reform.
no, that's
No,
what
but
I'm
this is
saying.
the
In their
insurance
brochure.
companies.
In their brochure, you know how they have all the clinics that they cover. So if we're
Oh,
so could be put on their brochure
Yeah.
as
as the
a
provider.
as a provider.
We're the only clinic that has an OB,
Yes.
GYN.
Yes.
The other clinics are
But
all
see, we need to get it in now
OB.
because open enrollment is like, I mean, they're probably already printing their stuff. So
Oh, and by the way, that OB is not gonna be taking Select Care anymore.
Oh, yeah, I saw that.
Your friend.
outside,
Yeah,
okay,
the-
outside.
Everybody says he's my friend.
Your neighbor.
He's my neighbor. Not my, you know.
Okay,
But we want
Party.
to still be on the
Party.
brochure so that there's exposure to the
Right.
government of Guam worker.
Yeah,
Provider list. We're
Yeah.
not in the provider list of Select Care.
Probably
not in the government, all she's saying.
No,
Government of
because
Guam,
I
eh?
came from Staywell, Northern and Southern
Yeah.
is in the
Yes,
provider
it is.
listing.
But they don't say what we have,
Yeah.
right?
Here.
yeah.
Yes.
Because I don't know if they highlight too the clinics, what the specialty of the clinics. I know they have the doctors.
I know
but-
that SDA.
Right.
So, like our colposcopies, we got zero waiting because they took care of it all. They're not doing anymore because we don't have anything.
Yeah.
And yet
Now
there's
a
women
new
out there that
person
need
at
it.
the Bureau of Women's Affairs. Do we
Well,
wanna talk to
I
her?
know who she is, so I'll talk to her.
So that, you know, she can put in like when they do their outreach, you know, cause they used to do them.
Yeah. Okay, Sarah, Hernandez. Yeah. Okay, so we'll go ahead and then you have two CWEP,
Yes, participants, so we get, these again are volunteers, so we got one for med records and one for maintenance. So now we have a total of 4 CWEP participants. One of them was actually picked up in another agency, so but we have 4. 2 in maintenance and 2 are gonna be with med records.
That's good.
So for the annual organizational goals for fiscal year 2026, you can read that, but if we go to page 16, so our goal is really to improve access to primary care services. So for 2025, we saw, as I mentioned in the last meeting, unduplicated patients served increased from 8,500 in 2024 to now 8,715, and our target for fiscal year 2026 is to maintain 8,700 to at least 9,200. Total visits have been at 21,000. There was a decrease. People are not following up, so our target is up to 23,500. Provider productivity, we're at 100 visits. This is per week per FTE. So our target is at 110, and no show rate. No show rate is at 26%. So we'd like to maintain below 30%.
okay.
So this is not 20%. That's too low for us. So if you can read these targets, we have met as a team last week, and then I think there's going to be a provider meeting pretty soon to also take care of the dementia screening. We are not tracking because we're not doing it, but we were able to have a conversation with Dr. Paulino, and he's going to identify which dementia screening we'll be using for the clinic. Another goal is to strengthen work capacity and workforce pipeline with student interns and trainees. We had a conversation with Gina, who had connections off island
Yes.
for physician assistants who are willing and interested to locate in the health centers, and of course the workforce training for our staff. And goal number 4 will be for strengthening organizational sustainability. So we will be tracking the claims denial rate, Debbie, and then of course the grant funding opportunities. Grant and funding opportunities we will pursue. The community outreach activities were actually very good in this, and we're also doing outreaches. So I'm pretty sure that 8 outreaches will exceed definitely, and the new community partnerships. Yes, so that goals are achievable.
Can we go back to strength number 3?
Yes.
Goals number 3, because you know we have this provider recruitment
Yes.
plan, and we have 2 people who are 2 contracts that we're still waiting on that need funding. Right?
No, they have funding.
They're funded now, so we did have funding. Okay.
That's why one's over at BBMR, and the second one is at the,
So
Okay, so I just want to make sure, because we've had problems with submitting these contracts in the past, and we want more providers so that we can see more patients, right?
Is that the law?
Yes.
yes.
The contract has, isn't it the contract has been executed? So
Okay.
we're doing the GG1 already?
for Duenas. Dr. Lee, there was a contract issue, so it was going back, according to downtown, it was going back and forth between the Laura and Laura Lee. And so supposedly it's all settled, so now that she's gonna be, it's at Laura Lee's desk, and then it goes to Kin, then it goes to the director, then it goes to BBMR. But Denise is already at BBMR.
to make sure that there was funding for that, because, you know, we want, you know, I'm listening, Chima has some PAs that wanna rotate in, that's wonderful, but we wanna make sure that we have the money to back that up. Okay, thank you,
So next would be the patient satisfaction survey. We're looking at months, December, January, and February. Patient feedback participation is stable and increasing. So our patients are engaged in providing feedback, so that tells us, you know, they care about our health center. Staff compassion and professionalism is very strong, and so so is provider listening and patient trust. Clinic environment and safety is strong. Appointment access is generally good. Waiting time is a concern for the patients, as well as phone access and callbacks. So we're going to monitor the 3 operational areas, the phone access and scheduling flow. We're not able to do this unless we have additional staff. So right now, how we're addressing it is through the QR code. And again, we're able to get back and call back the patient same day that they submit the request. And then improve on the waiting time before provider visits. So we just have to look at the workflow again. And then communication clarity with diverse patient populations. So this is a conversation that I've had with staff and they're aware.
have we talked about, or done research on, interpreters?
Oh, I'll get back.
Yeah.
Sorry, Chair.
Including the sign language, please.
Yes, I'm sorry, going back to the provider contract, Dr. Dolores' contract has been signed by the governor ever since February. It's the putting it in the system for the provider to be drug tested, approved, and be part of but the unclassified professional contract has been fully executed and signed by the governor since Feb.
Yep.
So we're just working on.
It's been here in public health since then.
So it's us to put it in the system?
Yes.
We are, so Laura is working, there's just, I think, discrepancy in the EHRP system. So
Yes.
Laura is coordinating closely with our internal HR.
Okay. All right, thank you for that update.
So you hear that?
Oh yeah, and by the way, just a side note, she is resigning from Total Guam next week. But the reason for that is that because she wants to spend more time with her dad, who asked her to spend time. But she still wants to do the 2 days a week with us. And then depending on her father, that will change. See, the initial sticking point was how to deal with her patients. But now she just, like I said, she's just going to resign because her dad asked her to and help take care of it. But even with that, she wants to work at least 2 times a week.
And doctor, she's also gonna work in the south.
South, yes.
That's where she wants to work.
Oh,
She's from Wyona.
Yeah, she's from.
both of them are in the south.
No.
No,
Duenas
Dr. Duenas is
up
here.
So he wants
No,
to do.
Dr. Billing.
Oh, Billing, yes.
Yeah,
They want to do south.
yeah, but we have the patients here. So
We
we're
could
gonna
have-
send,
If we better advertise, we'll have the patients down south. Because
okay, we're
just
gonna get pregnant and go to the south.
I don't know. I didn't hear that.
It's clearer already.
Okay, so in our patient satisfaction, it indicates that the quality of care and staff professionalism remain very strong across all sites. Main improvement opportunities are system and workflow, especially around access and communication. So that's definitely something that. Dr. Bob for medical directors report.
So as I mentioned, Dr. Duenas is down at PDMR. Once it gets through there, it goes to DOA and scheduled drug testing. Dr. Lee is down at Dr. Lee is at Laurel's desk, and I informed the acting director where it's at, so he's going to be looking in and hopefully be out by today. Dr. Lopez, he's at internal medicine and pediatrics, and he came out here and he's finishing up his residency, and it looks like we offered him, you know, a significant amount for here, but he's offered $450,000.
You said 230,000.
No, us. 450,000 in California.
Yeah, but it's far from his homeland.
I know. He said he was willing to go, but he was asking for a salary that's close, and he's not board certified yet.
Okay, so he's
So I did talk to the acting director and said, go ahead and offer $250. So I'll call him up and see what he says.
Where are you gonna get that money?
He says I'll take care of it. Oh, he also mentioned that maybe what needs to be done is an audit, because it's according to what Ken told him, there is funding. They just have to manipulate the books, because they keep saying there's no money, but and that's why he's going to order an audit to find out where all the monies are at.
Where is he gonna do the audit? DOA?
No, us, CHC.
Okay, this is the thing, is that DOA needs handles, and this is where our problem is when we submit our invoices, they're not taking it out of the different categories and they're supposed to
Well, wouldn't that audit
behavioral
take
health
care
is
of
still
that
taking
and find out where the problem
it out of
is?
program income when it should come out of the grant.
So maybe the audit would take care of that and say, this is you guys, it's DOA's problem that they're not doing what they're supposed to do.
It should be with DOA.
So that's why he wants to do the
So
audit.
who's going to do the audit?
I don't know, he didn't tell me. He just said, can you mention it at the meeting that they're gonna be doing an audit? He wants an audit done.
Who is he?
Peter John, because he's acting right now.
So he's over there. FMS is right next to him.
Oh, yeah. I'm sorry, because I was late. No, the acting director Peter John cannot be in today, so I forgot to mention that.
Oh, yeah, okay.
Okay.
So he just asked me to mention that he's gonna look into having an audit done.
Yeah, but the audit should be really with DOA, because they're not, when we submit our documents, they're not charging it to the correct accounts.
Correct. So if the audit is only, if whoever's going to do the audit internally in our department will just only be looking in the system, then that's a false information.
Then maybe you should talk to him about that. Because he says, mention it to the board that there's gonna be an audit. Well,
That's
Yes,
fine.
That's as far as I know.
We want that. We want that. We have been asking for that.
We want
Yes.
the audit.
It's fine, but again, if the audit is just looking into what in the system is,
It's
then
not
that's,
gonna come with the
it's
accurate.
not accurate.
Yeah.
What's already
And I've
there,
been, yes,
basically.
and I've been telling that to leadership, that whatever is reflected in the system is not accurate.
Yeah.
Because our view is different from DOA and PBMR's access view, wherein theirs, I don't know for how it was programmed, but it's, automatically updating, but our view is not. And our access, but we have internal ledgers that we can share, so that they can reference, right, Sharma?
Yeah.
So they can use that.
And
Okay,
in
thank you.
regards to providers too, we've had to tell 2 nurse practitioners, right, that we cannot offer them a contract because we don't have any funding. I also told, there's a couple physicians that, one out of FHP and one that was private, they were looking into working for public health, and I told them, no, we don't have the money.
So there's a strong interest.
There is.
Yeah.
People want to come to the health
They
center.
wanna work here.
Yes.
Is it because of Dr. Bob? Is that
Oh,
Because they know that he needs to retire.
no, they know my mouth, so they don't wanna, that's the one, they probably would have asked sooner, but they said, Dr. Bob,
You know
yeah,
why?
maybe.
It's because we keep saying that this is a health center for all.
Yeah.
For all insurances, not just for the poor, right?
Yes.
It's for everybody. And so that's why they want to come here, because they want to practice and serve everybody. So
Well,
that's
one
why.
of them actually was saying she'd like to. That person likes to see. Would like to see more people in need.
Yeah.
Oh, that's
And then she's an internist.
Yeah. See? See?
But I told her, sorry.
And we also had a nurse practitioner who's interested in going to finish her master's in public health. But we also said, hold on.
Yeah.
Yeah, we will revisit.
Yeah, I was surprised because in the beginning when I started this, nobody wanted to come here.
Yeah.
See, that's why it's your influence,
No,
Dr.
no,
Bob.
no, like I said, they know my mouth, so they don't want to hear me.
Well, thanks, Doc. Anything else?
That's it. So we did have an internist that I turned down, and a family practice that I couldn't offer a contract, and then 2 nurse midwives. Nurse practitioners.
Practitioners,
That
Yes. We need to expand our facilities if everybody wants to come. Maybe move them to the south, where there's extra rooms, right?
well, no, and then I do that.
And you rotate them.
But again, the problem with the South
The patients
is that we don't have the patients there. And then there are that with that student group,
Yeah.
there are a couple of people that are under scholarship,
Yeah.
and they need to go someplace
Yeah.
like us,
Yes. Yeah.
including one that has a father that's
Yes.
our good friend from AMC.
Yes.
No, he's
Between your
I said,
neighbor, yeah.
he's a good friend, I said.
He is
Or
good
now
for
he's
you.
claiming that as his friend. The other one is just a neighbor.
Yeah.
You can say his name.
No,
Oh, isn't that? Oh, that's a
No, I'm not
different.
gonna
I thought it's
but
authority
he
hands.
really,
Yes.
they're interested in working because they can get their scholarships forgiven.
Yes, no.
Yeah.
Yeah.
And that
Nope.
child
We
Not
can't-
forgiveness.
Just like this Lopez,
Yeah.
he was one of those guys, and we couldn't not. But then again, he also was asking a lot.
Yes, yeah, that's not too much, it's 3 much. Yeah. Okay, all right, thanks, Doc. Next on the item.
Oh, I forgot one other thing. We're gonna be doing school physicals in the south and in the north. So what we're gonna do is have all the pediatricians there, and I was assured that we will have all the
Vaccines.
supplies and especially vaccines. So that, because we're not gonna just see VFC patients, but see everybody.
Adults also.
And so
their parents.
hopefully, once we get it, we can then advertise it, and especially, I think in May 23rd,
Yes.
Yes.
So we have
There,
a schedule.
Tony?
It's in.
we're gonna be doing one in the south, where we're gonna do school physicals. For not only the,
But not just school.
Medicare,
It's
and
also
Medicaid, but
adult
also
physicals.
for insurance patients.
Well, okay, so that's what I was gonna ask. Is it also going to be for regular insurance patients?
Yes.
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 And including the vaccines and the
I hope so.
immunizations? Because, I don't want them to go down there and then you can't give me my flu shots and all that stuff because I have regular insurance. Okay? So everything's.
Oh, by that time, there's not gonna be no
Oh,
flu
no,
shot
but
because
at
of
least
the.
yeah.
Yeah.
At least the other stuff, right?
So I was assured that's gonna happen.
Yeah.
Oh, you already got?
Yeah, so we received actually, the vaccines came in, it's the two fridges are full to the brim,
Good.
and it's.
Did you
it's
ask
not a good-
immunization if we can store some? Do they have space?
In the south, yes, what she said.
I was asked, so because of the construction on Sunday, this coming
The
Sunday.
power's gonna go out.
Yes, so it's not. So, but they were assuring me earlier, Bob will be here.
Put a
It's
generator
from,
there?
no, everything shut down, including the generator.
Oh, that's
So-
right, because they have to disconnect.
Yeah, so they're saying, Bob is explaining to me earlier that it's going to be from 30 minutes, maximum would be 1.5 hours, so our nurses will also be here to monitor the
Can we get into the
temperature.
immunization program? Because they
Yeah, I
have,
already
That's what I-
spoke to immunization
Uh-huh.
program.
Michelle.
We're going to speak to GMH because GRMC already spoke to them in Jibwick, but no go for both. But the nurses will be here. They're gonna pack everything just in case it goes beyond the 1.5 hours that we were promised.
How about for the south?
No, there's no space.
there's some more
There's no space.
for the vaccines?
It's full to the rim.
Oh, that's what I was told.
Super full. Everyone, everything
Oh my
came
God.
in.
Can we just
And then we
double,
have to turn off the power.
can we just double check with you?
Do they have their
Make from the
refrigerator next door? Environmental.
Oh,
Environmental.
it's going for the entire.
Oh, the
entire
house?
yes.
The entire. No, for the entire clinic. Oh, next
No,
door.
No, the
no,
building
no,
next
no,
door
no.
is a different.
I
It's a different
Meter power.
they might have a different
temperature.
yes
Yeah.
for their refrigeration, but it's not.
We need freezer.
It has
and
to be only for
refrigerator.
the vaccines.
Yeah.
It
Yeah.
cannot be mixed with
Mixed,
other.
yeah.
Yes.
Yeah.
So we did check the south before we even called.
The
G-
What's
yeah,
the longest
we
it can be out of?
Oh, no, the
No, the temperature,
Or the
once it gets out of that temperature
Yes.
range, we throw it away.
Oh, okay.
Yes.
Ineffective.
Yeah, but we're communicating with GMH and immunization.
I'm sure Michelle has room in her.
Depends, Mayor, because what if they receive their stock as well?
Yeah.
Oh, yeah.
Because sometimes
Yeah.
when
We all
they
get
receive, once they
We all
receive their
get it at the
stock,
same time.
sometimes they always ask
Yeah.
for space here at North and GMH.
And that's what happened with Jibwick. They just received their stock of
There, that's why
medications
we
in
cannot.
the
Purchase orders all came in at the same time.
probably.
Okay, you've been so here. What's this?
And then turn off the
Turn off the power. Oh my goodness.
Yeah.
So yes, but we have we're ready in terms of the vaccine.
Maybe, okay, I was thinking if we can, if there's really no space, if we can ask our supplier, the vendor,
To hold it
To
just
hold
for the
it.
weekend?
yes.
Yeah.
We receive it already or no?
It's
It's
already
here.
here.
Or it's
all
already
here.
here, okay, yes.
Yeah.
all
Because
here.
that will be another, right, Mayor? Since
Yeah.
they delivered it already, then maybe they have the space. And
Okay.
if we can temporary. Yes, because if they have distributed, then they would have the space already.
Yeah,
Because
yeah.
Jimrick received theirs, we received ours.
Yeah, everybody received theirs.
Yes, then
received
GMH
theirs.
received theirs, then they have the space.
Okay, all right.
And I'll check with Annette. I'm gonna this afternoon.
We talked
Oh,
about
yeah.
this morning.
This morning. Okay, so she's
So she's
checking.
good.
Okay, thank you.
Okay. Then the financial, yeah.
Okay. So, you'll see on the spreadsheet here, the appropriation is at the bottom right
Yes,
at 3.2, and then we'll be uploading 1 million.
and that coming from grants?
What is
No,
3.2
pro-
program?
That's the
This is program
appropriation.
income? Okay. And the 1 million is coming from,
That's what we can upload.
okay. And Debbie, are we,
3.2 program income?
are we,
Okay,
working closely
Alright.
with DOA?
Yes.
okay.
All right,
The balance,
So
the
I
current
was just told by
available
Lee, they have a
balance.
whole empty refrigerator freezer that stores vaccine.
Oh, there. It's empty?
Empty
Okay, let
unit.
me check with Ruth.
Yes, so he says all I have to do is tell Rona to transport it down there.
Okay.
That's what I was wondering. They were running out of the vaccines they just,
okay, I'm sorry, Debbie, go ahead.
So the total available balance is 509, and you'll see that at the bottom left of the report. 509,000.
Yes,
Left.
That's what's-
After
yes.
all the expenditures have been deducted.
Yes.
and these are all already in our account, not for upload.
The 509?
Yes.
That's available right now in our account. Yeah.
So we don't have for upload,
Yes,
like
1
that we have
million.
received.
1 million.
1 million.
The minute you mentioned.
We're going to be uploading that.
I don't think it's here.
No, the 1 million's
No,
not
she
showing.
didn't put it
No,
in.
Oh,
not
okay.
yet.
Yeah.
Not yet.
So we need to submit the
Yes.
modification for that
Yes.
ASAP,
Mhm.
so we can fund some of the and make sure that our accounts are not on the red, the overruns, because we've been receiving notice from BBMR of the overruns.
Mhm.
So, and also in preparation if for the internal audit that I think FMS, if it's an internal audit, then it's FMS is going to lead.
Yes.
And then so thank you for doing the report for the total claims process.
Mhm.
Process means this is also submitted, right? On this date,
And that's a 2-week time frame.
just for 2
So
weeks.
March 2nd through the 14th.
On the next report, I'm recommending if we break it down by insurance. So our plan to reach out to the director, if Medicaid, if we have this same regular claim submission every 2 weeks, then we can request that they process claims, our claims included in the batch transmission every 2 weeks as well.
Okay.
Right?
To reflect.
To reflect, yeah, so that we have a regular request upload with DOA, because next step, once we establish that we're consistent with our claim submission, then we reach out to Medicaid to at least they process our claims regularly every time they do a upload for payment.
Yeah.
And then I'll join Sharma and Debbie with DOA and request that the upload should be done every 2 weeks, not when
That's good.
DOA
Yeah.
is available to reconcile all our
Yeah.
program income. Because I noticed that has been happening. Right?
ASAP, ne?
Yes, yes, Mayor. Yes.
Good.
Thank you, Debbie.
Thank you.
I move to accept the financial. Okay, there's a motion by Sonia to accept the financial report, second by Mayor Allen. Any discussions? No discussions, say everyone, those in favor say aye.
Aye.
Out opposed, motion carries. Okay, grant funding update.
So for our first grant, the liquidation deadline is at the end of the month, and we already received the new cycle funding starting April. It's already in our account. For the grant title 10, which is family planning, we have a non-competing continuation award application, which means it's still funded. So that's due on Friday, and our current funding that we will be receiving once we submit the application is at $315,000. Hopefully next year we'll be able to request for more. For the ARPA HRSA grant extension, so for the construction, the basic walls are up. They're running the lines for the power and already installing the doors and the windows. And then hopefully next month we'll be able
To close out.
to March, April.
Yeah.
And then for the ARPA HRSA renovations, this is already closed out.
How about for the grant funding,
For which one?
for the liquidation? Did we get an extension? Then we never heard of you, and then we might not be.
No, we did not. We did not do anything. We did follow up several times.
How did you submit the extension request for liquidation?
Let me check.
If it's email, because usually for HRSA, it should be uploaded into H. And I've been asking that from A. last year when we found out that, you know, it was not extended, maybe the way, number one, when I saw the reason for extension is because they have to receive the request after the end of the budget period. So if he have submitted that prior, then maybe another, or even just request for the liquidation period to be extended to 60 to 90 days. Because anyway, everything is already encumbered. We just need them to deliver the service, yes. Or the invoice for that.
Because we
is
received
already-
the last invoice.
Yes, yeah.
And then for the external funding and partnership outreaches, so we mentioned in the last meeting that we're going to explore other funding sources, and these are the organizations that I have reached out to. I already had a couple who said we are not aligned in our mission. That's Shell Foundation. I just looked at the companies that are in Guam first. Shell Foundation and Kellogg Foundation said we're not aligned in our priorities, so they said no. But everybody else, I'm still waiting. Home Depot said, apparently Home Depot has a foundation, and they're requesting for us to submit some documents, and they're willing to partner, especially in the renovation of this room for the community use. So we're gonna look at that. But if the board members can please look at the list, let me know if, and for the Guam Chamber of Commerce, thank you for putting the annual fee membership. We're going to be members of the Guam Chamber of Commerce. But if you can look at the list, if you know anybody, if you can follow up, I've already initiated contact. But if there's also some organizations and groups that you think should be on the list, let me know and I will initiate at least an introduction.
Maybe Westcare Pacific Islands, because they deal with homelessness, veterans, and maybe we can get on their agenda. Because they also receive a large amount of grants. We can be a sub-grantee of their
We
program.
actually have an MOU now.
With Westcare?
We're drafting an MOU with Westcare.
Pacific? Okay, good.
But it's specific for their patients that are in the group homes. So we're going to complete their TB testing as well as their physical exams. Not just for the patient, but also for the staff.
That's what I was gonna say,
Yes.
because their staff would also need the
Yes,
services,
yes.
especially for primary care, right?
So we have a draft already with them.
And then another thing is because they're gonna be working closer with expanding their homeless services. We can, the way that CPS requires their foster children to get physicals within the first 48 hours. I think if we work with them, with Westcare Pacific, and they start the application process, they can also refer them to make the appointments using our QR codes for primary care assessments. Well, no, you know, no,
CPS we already have.
no, CPS has an MOU,
Yes.
a SOP where when they first get the foster children,
Yes.
they have to
We
get
have-
like 24 hours.
We have a MOU
Yeah.
with
Yeah.
BOSA.
No, so
Yes,
I'm saying similar to that.
Oh, similar.
Similar to that, not because, they have to have their physicals, right?
Yes.
So similar to, we work with Westcare Pacific, when the homeless go in there and apply for the services, they'll require them to have that physical exam, and establish primary health care providers, right? Yeah. Okay, that's great, because this is something that we found out during our last conference, P&I, is look for philanthropists, right? Philanthropy groups and other organizations that can partner with us in providing services and funding too, right? So thanks, sure. Okay, anything else? Treasurer's report.
Treasurer's report remains the status quo as last reported January 15, $3,258.28. Please note there was no report in February as I was still off island,
Yeah.
so it remains status quo.
Okay, and then today we just did a check for our application for the Guam Chamber to be members of Guam Chamber of Commerce. It was $110. So we just the treasurer we just wrote a check to pay for that through this account. Okay. Thank you, and motion to approve the treasurer.
Motion to approve.
Okay, motion by Mayor Allen, second by Mayor Tony. Any discussions? No discussions. All in favor say aye. Thank you. Opposed? Okay, motion passes. Legislative and policy updates. We do have, it's a law. Well, there is a bill to expand recruitment pathways for physicians. So is there a public hearing on that? No? No public.
Yeah.
No, for the our
economy.
bill.
For the
Our
economy.
economy.
Yeah. Not for
But
the.
there's a
Yeah.
bill,
First one, yes.
yeah, there's a bill, so there's a public hearing for that. You know, it would be great, but we need money to actually have providers, right? So the public law, there's a public law that also creates nursing and allied health training annex at GCC. Is that at GCC?
Yes, at GCC.
Have you had do we have an MOA between GCC and us or not?
No, not yet.
Well, that would be good to
Yeah.
do an MOA between the Allied Health Program and the GC and the health center too. Don't we have students from GCC that come here? I remember seeing
GCC, no? Not GCC.
It's only UOG nursing.
Yeah.
a couple of months ago. I saw some GCC students helping the nurses' aides at the.
Oh, maybe that's Bureau of Family Health and Nursing
Oh,
Services.
okay,
yeah.
okay,
They're
yeah.
the one who has a
Okay.
partnership.
All right,
But we're exploring that.
Yes.
Yeah.
because GCC also has a
Yes.
and they just graduated with nursing. We have two, right?
Yes.
Two staff that are part of that.
Two or just
Only one? Okay.
Yes.
for us.
Okay.
She just needs to take the board, right?
Yeah, the
Yes.
NCLEX.
Because I asked if we can feature her in our social media, but she said she'd like to take the
NCLEX
The
expert.
board
versus-
members,
yeah.
yes. We might bring,
We might jinx it. Yeah.
Yeah, of course, she just wants to do it one
Yeah.
time, one
Yeah.
try, yeah.
Yeah, okay. All right, so, secondly, the healthcare funding substitute bill, this is,
So, if there is, yeah, so if the funding affects GMH, then the CHC should be ready because there's going to be overflow of patients. The reliance might be towards the health centers. That's why I included it there.
so if so GMH will not be able, cause their shortfall will be the funding, right?
Yes. The sustainability, overall sustainability for GMH. And so we have to step in and provide those services. At least for the acute care and chronic.
And that's where we'll have our walk-ins, right?
Yeah, so we have to be ready.
Okay.
So for the project activities and events, yesterday was very busy. There was a nutrition month activity in the morning led by the WIC program. In the afternoon, eating for heart health. This is specific for our staff. There was also demo, food demo by the PNS folks, but also Shriners providers
Are here until next week. And I just like to share, I met with their new chief of staff Jennifer and also Sherma met with her, and she's very grateful that we continue CHC continue to host their outreach clinic, and she had told there that, you know, so far this is her first time in Guam, but so far we're the most accommodating of all where she has been.
Good.
So cited, so, and of course we want to continue the partnership with them. So hopefully, you know, they do the outreach more than twice a year. Because right now their schedule is twice a year.
And I know right now we're hosting Shriners this
Yes.
week, right?
Yes.
And reminder, on March 27, which is next week, Friday, from 12 to 5, the clinics will be closed
Yes.
for the staff development. And on March 28, because of our MOA with, this is DYA, the Southern Clinic is actually going to be open in March 28, but very specific for the DYA youth. So we will be open from 8 to 11:30. Dr. Taitano will be doing the clinics, and in the north is going to be Dr. Bob and
We have the MOA meeting?
with DYA.
Yeah. We didn't see it.
Not yet. There in a draft form. I actually said we have to
complete it.
yes, including the worker
Before the 20.
Yes,
And
for the 28.
It's
And
only
they are
internally, it's only between the DYA and our leadership. Yes.
Yes.
That's right.
okay. So yes, so
What's
they
going on? DYA, what?
for the summer
partnership.
enrichment.
Summer enrich, not their
Not the
Clients.
Employment.
Oh.
Yes.
How many clientele?
so they're accepting up to 250, but I think half of those submitted interest, and a fraction of the 150 would be going to the health center to complete their PPD testing, and
Can we
physical
build that?
examination.
Can we build?
Yes.
So
It's funded by
DYA,
DYA.
at least for the PPD skin test, and then we will bill for the physical.
For the physical exam, the arrangement is if the child, because the physical exam and the PPD test is a requirement for the interns to receive health certificate with Division of Environmental Health. So just to ensure that, you know, there will be no delays on this requirement, that's why DYA reached out to us, and aside from Division of Environmental Health. So all the required paperworks, the physical, the forms, the result of the PPD will not be given to the parents or to the guardian, but directly to DEH, so that they can just immediately process the required health certificate. And that's the arrangement. DYA has some grant funding to fund this, so but we will still try to bill if they have insurances. If they have not had their annual physical and they are covered for that, then we will bill the insurances. If not, that they have used that benefit already, then we will bill DYA using our sliding fee program discount. So we will, anyway, we will still get revenue for the services. Yes.
On a different note, and not that I'm comparing DOA to DOC, but did you ever get an update on getting the clientele from DOC? I know we talked about that several months ago.
So the DOs, if they're incarcerated, Medicaid, they're not covered by Medicaid.
But does the DOC have a funding source to pay for their?
That's also the question.
No? So we don't
That's
want.
why they're going to the hospital.
Okay. Thank you.
So again, it's not here, but our in-reaches for back to school preparation, May 23 in the north, and July 18 in the north. Those are Saturdays, and we're going to do our in-reaches 10 a.m. to 3 p.m. and in the south, May 30 and July 25. So we have vaccines. We have
Same
vaccines.
time?
Yes, 10 a.m. to 3 p.m.
That's south, and then the north.
The north is May 23 and July 18.
Can we notify DOE about that?
Yes.
Even Head Start program too, because they also send their
Yes.
patients, their families, right?
Hopefully we'll have the PR by next week.
Does the same thing apply to the charter schools too?
Yes, yes.
Okay.
So, yeah, we just do we'll just send it to the charter school, board, and they will disseminate it to their schools.
You can reach out to immunization program because they already have the listing of all the schools when they disseminate communication.
Good.
Alright.
Oh,
Anything?
may
Yes.
I add to the activities I did mention on the last after the last board meeting?
Yes.
If we can have partnership with the CHC board in doing already fundraising for Relay for Life.
Yes.
So it will be partnership like simple ways. Maybe we put the purple bottle for donations and some activities.
You wanna
as
do a
well.
Zumba fundraiser?
Yeah, we can do that.
Yeah.
Yes, yes.
No, we could.
Yes.
Yeah. Let me check the co-op.
Oh,
What days
we can make-
available?
Yes. For that, and of course, it will have both EPHS and CHC board combined initiative in support of the Relay for Life.
Okay. When is the relay for
Usually in
May? I like
No,
before
no,
like
no.
Memorial.
November.
November na?
Yeah. Sorry, I lost track of. Yeah, we had it I think last year November.
And it's at the UOG
It's
field
UOG
house.
field house.
Inside.
Inside now, yeah.
Yes. So that it will give us time, to raise enough funds as well.
Let me check the co-op when it's available.
Yes, thank you.
So what would the funds do?
We donated.
Donated to American
Oh, just
Medical
donate.
and
Okay,
Cancer
okay, okay.
Society.
Yes.
I thought we're standing up a booth or something to.
No, it's just, and then it
In
goes
it, yeah.
under the
Okay,
Department of
okay,
Public Health.
Yeah. So it will be under the Department of Public Health and Social Services and plus of course
The community
CHC
health
board.
centers.
And the CHC board here because Community Health Center is still under the Department of Public Health.
Okay, alright. Okay, so we'll just, we'll check on the availability and I'll let you know.
Yes, thank you.
So we'll just put tickets,
Yes.
get donated water,
Yeah.
and then we could do raffles too.
Yes.
Yeah.
Oh, yeah.
Okay?
Then we can maybe, I don't know, some of the funds can be part of our initiative for cancer screening for CHC.
Yeah.
Right?
Right. Okay, anything else? Board committee reports, we do have a subcommittee meeting scheduled for next week, Tuesday at Manila. This is to deal with the, sliding fee, the bylaws,
Bylaws,
the
Co-applicant.
strategic planning.
Four or
for
five.
applicant, four,
I know you
four
mentioned
things.
4 or 5.
Yeah. Okay, so that'll be 2:00 at the Manila Mayor's
Which one,
office.
remind her name, the
Yeah,
email so
yeah,
everybody can see
okay.
it.
Alright. Okay. And
Sorry,
then,
what day is this again?
that's Tuesday the 24th.
And I think that's 5, right? 5,
4,
Or 4,
Four.
okay.
What time is it?
2
2
p.m.
p.m.
to 5.
At
at the
Manila
Manila
Community
Mayor's
Center.
office.
Multi-purpose. Multi-purpose.
Okay,
okay, got it.
Yeah.
and then CHC Board, Education.
Yeah, so just a reminder, the board also has oversight on the quality of care that we provide to the
Yes.
patient. So we submitted
You know, cause they really keep track.
And we're doing it manually because we don't have, so once we get
The
next
EHR.
gen and the new EHR, then we just input whatever data we need and it will populate it. But right now, if we need to see how many among the, let's say, 45-year-old to 50-year-old have been provided this screening, they go
To the
to
chart.
each chart.
Do the
Because,
stats,
yes,
physically.
yes, because from what I heard, they didn't have training with our current EHR, so the providers and our nurses are not putting data where they're supposed to be at. They're only finding out that there is
There is
an area where I
where you
could have
can-
put it. Yes.
Yes.
They'll know
And
the
it's
categories.
because it's no longer supported.
Yes.
It's just being sustained by OTEC for our current RPMS to continue on. But it has the capability to extract the required reporting. But then again, I think there was a gap in previous
Where they're inputting.
yeah, and plus every time there's a new nurse, there should be our staff who's accessing the electronic health record to have at least an orientation on what information that needs to be inputted and required.
So we saw in 2025 8,715 patients. They had to go in 80% of those charts and check manually.
Oh my gosh.
80%. Yes. So almost all of our nurses were staying back and coming in during the weekend to do the audits. So we still have one more year of that, which is 2026. Because 2027, hopefully,
The EHR will
the
be in place.
EHR.
How I think since we're doing it manually for now, I think we have to do have a schedule of completing the QI reporting. So when it's time for us to submit at the end of the year for the UDS report, we just need to combine everything that we did for the past. Like if it's quarterly, then at least we target, not we are rushing at the last time, and then as you mentioned, it's 8,000 charts that they have to go through one by one. So I think if we can put that in the regular schedule to do,
I think Chief, they're doing.
They're already doing it.
they're already doing
Yeah.
it.
But
Okay.
it's
Yeah. Okay.
So that's why we have to review the key quality indicators such as the access to care, chronic disease management. Some of them are in page 6. So these are the goals to improve clinical quality and preventive care, especially to control hypertension, bring down uncontrolled diabetes patients with annual A1C, dementia screening, among others.
Yeah.
So once it becomes available, I will also send you guys the link for the UDS for 2025, but the UDS for 2024 is already available. So that's what we're working with. And this is to make sure that we meet expected standards, and this is also aligned with the HRSA Uniform Data System reporting that we will also be reporting on when we do the on-site visit with HRSA this year.
Yeah. Did they give us a date yet of when
Not
they're?
yet, but we met with our new project officer for HRSA.
Do you have a name?
Yeah,
Oh.
yes, Karim. I forgot his last name, but he did confirm that it will be an on-site visit. It's not going to be virtual.
I think that's better.
Yeah, it's better.
Yeah.
But it's going to be this year. We're due for a visit.
Yes.
You know, for example, like in like controlled hypertension and diabetes, that's our current baseline rate, but that's not best practices or
That's our data,
our data.
but our the target numbers are not here. Oh, they're here. Oh, this is our baseline and our target, but
Yeah.
this is not the standard. Yes, that's right. can provide the standard as
So
well.
how did you derive at a target, you know? So for example, like uncontrolled diabetes of A1C, our current ratio is 51%, our target's only
49%. We'd
yeah.
like to be realistic. So for example, with the uncontrolled diabetes, we did form the team last year, but we didn't see any improvement. But also, the number did worsen. So we stayed at 51%.
Yeah.
So when we created that team, where the social worker was the lead and the patient was seen by the provider, by the nurse, by the pharmacist, and also referred to behavioral health. So there was a improvement of 10% of the patients that we saw. We only, so out of the 700 some patients who have uncontrolled diabetes, who had diabetes, 300 some, 51% had uncontrolled diabetes, which was 300 some. We were able to follow up 30 patients closely, and 10% of them, which is 3 patients, had improved A1C. From their A1Cs are more than 10, and we improved them to almost normal,
6.
to 9 and 7. So it was great, but because of staffing issues, it was very difficult to have a lead and to follow up each patient closely. So we're trying to be realistic also with our
So
targets.
the way I envision this, right, is that, so for example, you got those like real great stories, right, the 10 to almost normal, right? So as part of what I'm suggesting is part of your team that you're doing this. So part of your team that's doing this, right, I would bring these people in that are considered the rising stars and be able to advocate to the very patient that we're trying to target. Because if it's just the same group, you know, you look at it like Alcoholics Anonymous, right? When you got people that already went over the hill and are now free and clear of any alcohol abuse or use, you want to bring that same people and tell them what was their trials, their tribulations, their journey, because a lot of them can resonate with that, right? But if you're just talking to the same professionals, sometimes you know you don't have a lot of credibility. When you can tell me a story,
You don't understand where
exactly,
I'm coming from, but if it's someone who have
absolutely,
overcome
they
it,
can
yes.
really relate
They
to
are,
the
yes.
same message we're trying to relate. So it's something to think about.
Drill them in to
Very
tell their
good.
experience.
And I think what Mayor Tony was asking is the standard reference value, and I think that's available.
Yes.
Yeah, so that's what he was asking. Where are we based on the national standard? What is our
But you try to reach some
benchmark? Yeah,
2%. I
national
think that's
benchmark. Yeah.
you know, you're not putting a lot of effort in there. But you're telling me from 51 to 30, man. I mean, I know that you guys are doing a robust approach to resolving that issue, right? But of course, and I know we're taking a vicious snail space because we have to adjust as things go along. But I believe that if you can get somebody in here that went through the same journey and tell me straight up, because like you said, you understand my struggles, and
Yes.
that
If you have
becomes
been
very
there,
personal now. Like, okay, he can do it, I can do it. So
And plus we have BMS, BSNES staff. So if you can start scheduling our patients.
because remember, one of the things I said to you was that we need to spend a lot of time in talking about how to avoid getting to the kidney, what is it called, dialysis?
Dialysis, yeah, and
How do we
stage
get to
renal
there?
disease,
And
yes.
so, when we get people that are currently going through dialysis, let them, if they're willing to kind of give their self-accounting of, they wish they tried better. I mean, those are, real good, credible people that can change. It's like if you're telling me, like, drop your weight, but man, it cannot be somebody that's overweight, that, bigger than me, tell me to reduce my weight. When you give me somebody that used to be big and now, wow, okay, now, okay, thank you.
Alright. So what do you need us to do? Do you need us to do something in particular to
No, this is just something that we will have to track.
Yeah.
So in 3 months, I will present the data and see where we're at, if there's any improvement with the efforts, because there are efforts. So with the diabetes, as this chief has mentioned, we have a staff who is now doing the education part. We actually have links already to videos that we are showing our patients here in the clinic.
Yeah, so I did ask the staff a couple of months ago, you know, UOG also has a program with cooperative extension, where it used to be a walk to wellness program.
Yes.
We did this in the villages,
Correct.
but we can do it here in the health centers, both northern and southern. And the doctors, because I saw this in Hawaii, when we did a tour of the Wainai and the central community health centers, where the doctors did referrals for their diabetic patients. And it was like a walk to wellness program. So for midday, patients can come in like to a room like this, and they had just an activity coordinator where they did nutrition for like 15 minutes and showed how to do meal preps. And then also, then they did
What to look for.
just seat exercises, chair exercises, because some of them were patients who had mobility issues, right? But they were diabetics, and so working with like cooperative extension over at
Pat
UOG.
Lucis was part of the team as
Yeah.
well. And
But
a couple
Mark
of
Acosta from
yes,
UOG.
Mark Costa.
Yeah, cooperative extension
Yes.
can be part of that too.
Yes.
And then they had incentives. They had like Payless gift certificates for those. So you come in for, if you did 2 weeks and you attended all 4 sessions, they gave you incentives, and at the end of the month they had raffles where they gave you a $20 gift certificate for Payless. But of course you couldn't buy alcohol, sodas, or cigarettes, right? You had to use it towards
Something healthy.
Yeah.
Yeah.
Healthy meal,
Yes.
meal preps.
Yes.
So we can do that part of,
Yeah.
and it's a program that, and even with the Zumba, right? We can have Zumba like maybe quarterly and encourage and do it for our patients and our staff together,
We
right?
can use this room.
Yeah, no, you absolutely.
Yeah.
But you may need a bigger room, right? Yeah. So even just doing it out in the park, right? Yeah. Okay. So yeah, that we can work with you directly on that. Okay. Okay. Anything else? No?
Kevin,
Yeah, can I just add on something?
Yes.
So you know what, we sit around, right, and we're always trying to redefine ourselves or get a good understanding of where we at in terms of our operation. So I'm gonna share a little story. So when I was at Guam Waterworks, when I became the assistant general manager, one of the things that we launched off was what we call a peer review. We reached out to Hawaii, we reached out to I believe it was Arizona, Portland, Oregon, all the general managers of the water utility company. We invited them to come out and do what they call a peer review. We have the same people that were operating at our level, but be able to tell us, give us a rating of what is it that we're doing, where can we improve, or what is it. So we did this thing. It's called a start, stop, continue. Tell us what we should start doing. Tell us what we should stop doing, and tell us what we should continue doing. So while we try to evaluate and assess where we are at in our operation, where we are at, how can we become better, my recommendation is reach out to the CEO of Saipan, Hawaii, Oahu, or anybody that's willing to participate in this review. Come out and we embrace everything that they tell us. We are going to be very receptive when they tell us, because honestly, I think if we truly, really want to break new ground and become better at what we do, we sometimes need somebody else to tell us what it is, right? If we're just amongst ourselves, praising each other each and every time, oh yes, improvement is improvement. The question is though, how do we go from 1 to 2 or 5% improvement to exponential 40% improvement? Sometimes we need people to kind of tell us, and I appreciate everything that you guys are doing, awesome. But you're hearing it from the same people telling you that you're awesome. But if you can actually get folks that are living and this and breathing this kind of environment every day, and especially if we're very receptive to get any kind of criticism, taking it constructively, whatever it is, we're all going to become better, right? And I use this analogy a lot. A lot of the kids on Guam think they're really good in basketball. when the day they land in Los Angeles, they realize even the people playing in the streets are better than them, because we're constantly just mirroring ourselves each and every day. But if we can get somebody else to tell us exactly what we're doing wrong, what we need to start, stop, and continue, then I think that would be a great path. I think that idea comes up because, you know, when we talk about 51% A1C to just 40, you know, we're just putting it in there just as a safe number, but no, let's break out of the comfort zone. Let's target 30, you know. But how do we get there? And maybe there's districts that are already doing that and championing that. Question is, how do we get to that level, right? So, and you know, sadly, we're a very small island community, and whatever is little good sometimes means a lot good, right? But what could be the greater good? And that's kind of where we need to focus. So, you know, you guys are here, you guys are the one running the show, but if you're open to that concept, it's something that I would support as a board. Let's reach out, send the emails, and set up a date. We'll bring them all in, and at the end, as a board, we would like to see how they view us. And from there, we can now, in turn, step up our level of support and determine what else is needed to better the operation, right? Because if we're talking about building more clientele or patients here, are we prepared for that? We're kind of saying yes, but truly are we there? So kind of just, again, a little input.
Okay, all right, thank you so much, Mayor Tony. Okay, do we have anything else? Nothing else? So do we have a motion to, setting the next meeting, our next meeting, the next, Thursday is April 16th. Do you think we'll have noise here? No? Can we have it here again? Oh, yeah? Smiling, but sure. You're not sure. Yeah.
She doesn't want to come in anymore because
So should we do in Alahan again? I mean, I don't mind driving down there, but
Just to be on the safe side.
just to be on the safe side, we'll go to Southern Health Center. Okay, April 16th at 10 o'clock
What about you, Mayor?
at the Southern Health Center.
I
It's
wish,
not big.
but it's not big enough.
But it's
Only that
small.
one where we did the,
Yeah.
So what you said, multi-purpose?
that's what we call it.
Oh, okay.
Cause it's used for everything.
You for
oh, your
everything small.
definition of multi-purpose is really the big one.
That's what I like, man, to the space.
The aircon's not working.
Nice and cozy.
Yeah.
Yeah, okay. Unless, is your aircon working down in again?
It has learned, but we cannot increase it because there's already an air condition, but we cannot increase the temperature or lower down to be
So
more
it's freezing?
cooler. And not really freezing, but it's just, you know, not. There's
Is it like this? Like this?
no, not a little bit warmer.
Yeah, it's
Yeah.
okay. It's alright. Southern is
It's
fine.
not that warm, hot warm.
So
but
we won't
it's
hug
not-
in that meeting.
Yeah, we can because we had a meeting last
Oh.
Friday there.
Okay.
So if that's okay
Yeah,
with the board,
that's fine.
Yeah, then-
Okay, can we check if,
Yes.
That's fine.
if it's available? And then if it is, we'll do it at Hessler?
Yeah.
Okay, so it'll be 10 a.m. Hessler, August 16th, April 16th. Okay,
I motion to adjourn.
okay, there's a motion by, Annie to adjourn,
Okay.
second by Mayor Allen, all in favor? Okay, opposed? Okay, we're adjourned at 11:49. Thank you so much.
Record breaking.
Molly.
Mayor?
80s, not the same 80s.
Thanks.
What's up?
Thanks, Ed.
Yeah, yeah, oh, yeah.
Dr. Bob, is this yours?
If you want.
Oh, 'cause you know I have to leave.